All right, we are live.
Good morning, everyone. We'll be getting started shortly. Thank you for joining the Fox Cities Chamber of Commerce, Elevating the Employee Experience webinar. Just give it a few more seconds and we'll get started. Well, we want to thank you so much for joining us this morning on this cold, brisk morning. We know it would be wonderful to stay under the covers, but we really appreciate you taking time out of your day to be with us. This morning, if you have any questions, we ask that you use the question and answer feature, and we will have questions at the end of the webinar for expediency purposes. So we'll go ahead and just jump right in and get right into the topic. If 2020 has taught us anything, it is that the employee experience extends beyond the boundaries of the workplace. In fact, it really it enters every aspect of our lives. And as we know, we really need to find the tools and strategies in order to really communicate and engage our employees for well-being and to really be a bit healthier in the workplace, especially in this time period of COVID. We've learned that mental well-being is especially important as we move forward. We know the future of the workplace is changing and it's evolving over time. And we know that it's important to take a pause and to really think about what the workplace is going to look like going forward. One of the programs that the Fox Cities Chamber of Commerce has put forth is the Employee-Friendly Workplace Initiative and Certification Program. And we feel that if you haven't heard of it, and we know many of you have, but it's really focused on implementing employee-friendly workplace policies and practices. We're really focused on enhancing, work-life integration and really fostering a supportive work environment for all Fox cities. So it's really critical for us to focus on employee attraction, but more importantly, to retain the employees that we have in the Fox cities and at your workplace. Without talking too much about employee-friendly workplace, which we do hope that you will take a look at that program, because it is an important tool to help you as an employer look at how you can improve, identify gaps that may help you improve and have a more supportive work environment for your employees, improve presenteeism, reduce turnover, and burnout as well. And so please feel free to reach out to us and we'll have more information for you after the program. The presentation will also be available for you as well, and more information about that at the end of the program. Without further ado, I'll introduce to you Will Robinson, who is the Director of Business Development with Foresight Benefits and Motion Connected. So we want to thank them for presenting today and partnering with us. And Will, take it away.
Thanks, Jennifer. We're excited to be here. Jennifer and I we're talking a little bit about the Employee-Friendly Workplace Initiative, and I think it's an awesome program. But what we were discussing was some of the results from the Fox Cities Chamber Benefits Survey. And there was a lot of things around employee well-being that were coming up, and that's what we've seen as well. But just to make the connection, Foresight's been around since about 2004, investing in a lot of technology and data analytics tools for overall population health management. And Motion Connected is actually part of one of those investments that's helped us to grow to one of the largest independently owned health and wellness consulting firms in Wisconsin. So huge part of what we do to manage the overall employee experience. But over the last 10 years, what we've learned is there's a lot of wellness initiatives that just don't work. Sometimes it's hard to get buy-in from leadership, which is crucial. But we luckily have found that if you do it correctly, there's some pretty major impacts on your benefit costs, on your employee turnover, some other great things that Sarah and Amanda are going to talk about. But today they're going to share a little bit about what we've learned in the last 10 plus years, some recent trends that I'm sure we're similarly seeing in the Fox Valley, and then most importantly, share some ideas on just really how to focus on employee well-being, so you can create an environment that is an employee-friendly workplace. So again, thanks, Jennifer. Thanks for everyone who's joined. We're really excited and passionate about this topic. And additional questions will be addressed at the end, as Jennifer said, and also keep your eyes out after the webinar to get an additional email with slide deck and some other things to follow up. So yeah, without further ado from my part, Sarah and Amanda, I'll let you take it from here.
Great, thank you both, Jennifer and Will. As they've stated, my name's Sarah Troop, and I'm the Director of Wellness Strategy at Motion Connected. And I've been working with employers like yourself in Wisconsin and across the United States, implementing wellness programs, really with the focus on what works. And so that's one of the things I'm really passionate about, our data analytics, and taking what we learn from our clients and building better programs year after year. A little background, if you haven't heard of Motion Connected before, this was we are a wellness platform and software solution that was launched by Foresight Benefits and Wellness in 2008. I came on, they launched it for their own clients in an effort to try to mediate increasing healthcare costs, claims costs year after year. I came on a few short years after that and helped them launch Motion Connected nationwide at a national SHRM show. So since then, we've grown with clients of all different sizes, from down to, I just enrolled a 9-person group the other day, so I was really excited about that, but 9 to over 70,000 employees with client locations across the US, Brazil, Mexico, and Canada. We have been working very closely with Cleveland Clinic's employee health program for the last 5 years, and they have a very successful program in terms of plateauing their prescription costs and employee contribution costs to their health care over that period of time. So we've learned a lot from that program that we get to bring back as best practices to all of our clients. We're also the software solution for when people want to buy Garmin devices. Garmin makes great hardware, but they don't really have a corporate wellness platform. And so we partner with Garmin to be that platform for those clients. Today, myself will be bouncing around with Amanda Rudd. I'm excited for some of the things Amanda will be able to share with you, because last year at this time, she was basically sitting in your shoes, working at a corporation as the wellness lead, also doing some dabbling in human resources. And we worked together. She was using the Motion Connected program to run wellness for their 140 employees. So I'll turn it over to Amanda at this point to tell us a little bit more about herself and her story.
Thanks, Sarah. I appreciate it, and we're very happy to be here this morning. As Sarah mentioned, I'm the former director of corporate wellness for a mid-sized construction firm in the Midwest, and I was in this position for a little over 8 years. And you know, we really had a very traditional wellness program: do an HRA, complete a biometric health screen, smattering of the other programs, lunch and learns, challenges, and then the employees and their spouses were able to earn the incentive. And what I really started seeing each year was that we were not getting more healthy, and actually, as an organization, we were trending in the opposite direction at health. And in 2018, we had 2 or more risk factors. We were high risk as an organization. So I knew that we needed to change our approach, and we needed to change it in a drastic way. So I started looking around at some digital vendors and app providers. I knew that we needed a digital solution to really reach a diverse workforce. This organization works in a tri-state area, doing projects in job sites, really from small to large. And we also had spouses participating in as well. So we needed something, a communication tool that also reached spouses. So actually, Motion Connected was the last group that I looked at, and it fit the bill. It had everything that we needed. And so you can see the metrics that right here, but this is after just 1 year. And this organization is still using Motion Connected for their wellness platform. But after 1 year, we were able to move from high risk to low. And so it really encouraged year-round behavior. It improved eating habits. The group that started the year at a normal weight maintained a normal weight for the entire year. And so we really had a lot of success with it. And I am very proud of what we were able to accomplish there. So actually, as Sarah mentioned, I am no longer with this organization. I'm very excited to be with Motion Connected. Last year, my husband was presented with an opportunity to join a coach that you may know well in Wisconsin. And so my family and I are now in Dallas, Texas, and I'm just thrilled to be part of the Motion Connected team. So I'm going to turn it back over to Sarah to start the discussion this morning about elevating the employee experience and really going into our new normal and what that means for us.
Great. We're excited to have Amanda. But as we all know on this call, 2021 right now today looks so different than where we were a year ago in 2020. And I really think that no one is observing this more than human resource professionals. It was a rough year for employers and HR professionals when you're helping your workforce to adapt to this new normal, and in some cases, maybe even having to shrink your workforce. It's led to this where we are today. Very few in-person meetings. A year ago, we would have been doing this all together, and it would have been great. But we are on these video meetings. Whether you have a fully remote workforce, partial, or everyone's back in the office, I mean, from what I'm seeing nationwide, most employers have a larger remote workforce than they did a year ago. Sorry. And this has had to lead to employers that have to manage flexibility, whether that are, employees that have to be also teaching their students who are now at home, whether that's the flexibility of isolation and quarantining. There's just a lot that we are dealing with, and you never know, right? It just pops up on you. And so that's these challenges and these pivots that we're having to make on a daily basis with our workforce. And it's just something that we have to deal with, and we have to deal with it as employers, but our poor employees have to deal with that as well. And so what I'm hearing from employers is that it's leading to a lot of burnout and a lot of stress. I think those last 2 points go together. The future is unknown. The normal with all the screen time is just burning people out. And it's leaving a disengaged workforce that's not sure of what this future holds. So what we did is, I've gotten to take a lot of time with the clients that we work with and understand what their needs are, how we could help them. And we've turned that into, how do we learn to adapt for the long term? And so the biggest problems I was hearing when during March through, I would say, September is, how do I communicate with my employees? And so we'll talk today about some communication methods to reach your diverse workforce, no matter where they are. Also, like, how do we just, we're used to the water cooler, we're used to fun company picnics and get-togethers that we use to engage employees. What do we do now? What are our engagement strategies currently so we can attract and retain employees? And then finally, where does well-being fall in this new normal? So those will be the basic 3 points we'll be focusing on. To kick it off with communication, what we are learning and seeing, and this is based on your different generations, your different demographics, is that we need multiple vehicles for communication. A lot of people respond well to email, but a lot of young people don't respond to email very well. They barely look at it, but they're big on push notifications. You might have people who aren't into technology at all and still rely on mailers. So the key to reaching your entire workforce is to utilize multiple vehicles whenever possible and maximize the ones available to you. Repetition is definitely the rule. You have to repeat your messages frequently through your multiple vehicles. And though this is because of the abundance of information that is coming through, you have to compete in that abundance of information. So repetition is one of the ways that you could do that with your messaging. And being authentic. This really speaks for itself, but employees will gravitate to your messages when they have purpose, when they have intention, when the employees feel like it's really meant for them and their years. Another good practice is to create a sense of urgency. Even if there really isn't a sense of urgency, put a deadline on it. If you're looking for an action from employees, tell them how important it is and create that sense of urgency as needed. And finally, with everything, I'd say with well-being, with engagement, with communication, keeping it simple is key, but yet appealing. There's a lot of great tools out there for you to help make your messages appealing. One I even heard at a conference back in last January, a lot of wellness professionals and human resource professionals were using Canva to make very quick, simple, and appealing messages and posters and email templates for employees, or busting out videos whenever you can. Our iPhones or any of our smartphones have really good video equipment. Maybe sometimes saying it is better than writing it. And so capturing a different type of audience that way. So putting this all together and making sure that when you have important resources your employees need to know about, your EAP programs, your teledoc, all those great services you're offering, get that out beyond just open enrollment and use other communication methods to let employees know how much you care and what you have to offer them. Amanda's going to touch upon the next point, which is engagement.
So engagement really, engaging employees, retaining employees and attracting new employees, they're all really, it's really key to have a strong corporate culture. That's really the center stone. And first off, leading by example, that tone from the top, the tone from the leadership is one of the most important things. Really by having that leadership buy-in and sets programs apart from others in terms of success. And not only leadership, when we're thinking about the top, but also trickling down that leadership line. So leaders, middle managers, direct supervisors, project managers, those cascading values are extremely important to the rest of the organization. There are also informal leaders at each organization, and you each know who these people are, but it's the individuals that have perhaps have been there for a while, that other colleagues go to when they need something that they value and respect. And these informal leaders can really be your champions. They can convey your message, and they also have a strong impact on the culture as well. Now, formal policies are also a strong component of this corporate culture, and this may not be something that we think about right away, but having a formal policy for paid time off, flexible schedules, a healthy work environment, that makes a big difference. And going along with these formal policies, it's one thing to say it, it's another thing to really walk the talk. So set the policy, but then have accountability around the policy. Set metrics around your corporate culture. And it could be analyzing the percentage of employees that took vacations or paid time off, the number of internal promotions, or even the percentage of employee contributions in a retirement program. They're going to give a good snapshot of where your employees are and perhaps even ways that can be improved. Now, Sarah covered effective communication methods, but one more point on communication. Make sure employees have the opportunity to have a voice and feel comfortable speaking up, whether that's in an internal review or the review process, or even just speaking to a direct supervisor, having that open door policy. It truly does make a difference. Of course, a recruitment strategy, training program, rewards or incentives are also part of a strong culture. And lastly, and really perhaps most importantly right now, is to have a diverse equity and inclusion strategies at your organization, really this multidisciplinary approach to engage all employees at your workplace. That's truly important. Now, when we're talking about engaging employees, there are many different ways to engage. The first one, and perhaps most important, is just to ask them, have a survey, an employee engagement survey or an informal survey, that find out what your employees need. And it could be because of this pandemic, we're constantly being faced with changing work environments, working from home, remote, flexible schedules, or working in the office. These needs may change over time and continue to change in the future. So having this touch point with surveys is key. You all know your organizations best. So engaging employees in ways that fit your population, know the population need, and really offer a diverse amount of ways to engage. Now, parental leave, I just want to make a touch point on that. Parental leave, whether it's a new child joining the family or whether a parent needs time to go home or be at home to help their child with remote learning or childcare, that's really being expanded upon right now. So FMLA is a good resource, but it's short term. So 8 to 12 weeks of a parental leave is not that much time when we're faced with the pandemic that we're in right now. So we're even seeing organizations extend that leave to 12 to 18 months, calling it a pandemic leave, and giving the employees the ability to step out of the workforce, but retain their job, retain their same salary, and come back after that period of time. Now, one more thing I want to touch on is really around that parental leave. It is the impact this pandemic has had on mothers, and especially working mothers. And working mothers, all mothers, shoulder the childcare responsibilities and the majority of that remote learning environment. Just in September, of last year, 865,000 women dropped from the labor force, meaning they're no longer working or working for work. And this number is 4 times higher than men during that same time period. Additionally, women in leadership positions are looking to step down from their role or have less responsibility or a decrease in hours, really due to the pandemic. And it's not the main reason behind this is that we can't balance everything. We literally cannot have a full-time job while also being responsible for childcare and this being a teacher, teaching our children. So organizations are really looking at creative ways to engage women, to retain them in the workforce. A possible solution may even be centered around childcare. So childcare subsidies, or even additional trainings and policies to help women re-enter the workforce when they are able to. Now, another engagement tool to support employees are employee resource groups, or ERGs. ERGs are voluntary groups that are employee-led, and they really give employees a voice. So these groups can be put together that are very custom to each organization. So it groups employees together with similar situations or similar demographics. Again, it gives them a voice, someone to connect to. facilitates these connections, boosts culture, and overall boosts engagement. And there are many, and especially some of the larger organizations, they have really seen these ERGs have a large impact on employee engagement and really being comfortable to being in the workforce. So there are some examples on the right-hand side of your screen: women in technology, construction, manufacturing, leadership, single parents, working parents, veterans. And again, surveys are an excellent tool to utilize to really see where there is interest within an organization to form an ERG. I'm going to switch back to Sarah, and she's going to discuss the third strategy in elevating the employee experience, and that is the role of well-being.
Yes, this, it's easy to wonder at this point with so many other things on if well-being should be one of those focuses. And when we say well-being, it's more than just physical health. There's so much that goes into it, from emotional to occupational and financial. And truly what I wondered, I was like, wow, I wonder if people are really going to be dropping their well-being programs, support and services just to be able to focus on work and the remote aspect of things. Will this be a trend? And I know that I saw just the opposite, that it really actually picked up. But it has been studied as well. Artemis Health does these research papers every year on what employers are focusing on. And last year's big winner of focus was number 2, the improving employee satisfaction and engagement. But as they did this at the end of 2020, going into 2021, improving employee health and well-being became a higher priority for at 78% of the time for organizations. So I think that's significant on the pulse of where things are at. And the Artemis Health paper actually went on to say that there'd be a renewed focus on employee health and well-being in 2021. And it's what we think. It's directly linked to that of the pandemic, where benefits leaders and their organizations believe it's hard employee health. So why is that? Why is well-being and employee health so important right now? Well, one of the things we're seeing is that during the pandemic, physical health and staying healthy is more important than ever. A recent report from the CDC had some striking numbers that showed that 94% of US deaths involving COVID since February of last year were associated with other conditions or comorbidities. And basically that lifestyle factors contributed to the onset of that chronic disease and these diseases. So it is something that we can all be doing to maintain our physical health, to be able to bode better during this pandemic. But then it's the other things that we've talked about already. The fact that there's more remote workers, it means a lot of things. And it means, even though it seems like we should have more time, we're really seeing that it's more that employees are more sedentary, sometimes not even getting out of their pajamas for working, but they're closer to their refrigerator, they're snacking more, eating more. And worst off, right when we need our friends and family, we're more socially disconnected. So we don't have our coworkers to rely on and boost us up and improve our mood. So lots of effects that are coming out of simply being a remote workforce. And then finally, with the unknowns, or maybe one of your employee spouses lost their job, their income's decreased, they're taking on more duties, they're teaching their kids. The fact remains that employees are more stressed than ever. And all of these things, all of these effects certainly can have a big effect on their work performance. So focusing in on the different 8 dimensions of well-being and assisting employees is something that employers can do. Now, one of the toughest ones to take care of, and I'm going to throw it back to Amanda with her coaching background, mental health. This is a really tough one to tackle, but we're here today to share some different ways about going about talking about mental health and giving your employees the resources need at this time.
Mhm. as Sarah bringing this up in the workplace, it's hard. Important to remember is that mental health is really the center of whole person wellness or whole person well-being, and everything else kind of circles around that and is interconnected. It's important as an organization, if you stick the label, the mental health label on it, if you do this, this will improve your mental health. That's not very appealing. And there is such a stigma still associated with mental health. It's getting better. And certainly through this pandemic, we have been talking about it more. So there is more awareness, but especially in blue collar industries, especially in the workplace, it's not really something that's being talked about as much. So there are many different activities that can be done that really focus on mental health that are proven to improve mental health and well-being without, having that big mental health tag on it. So whether it's physical activity challenges, encouraging taking breaks outside, posting nearby trail maps, setting definitive work hours, some virtual collaboration, whether it's just talking shop around and having a cup of coffee, those all really make a big difference for overall mental health and mental well-being. Due to the pandemic, there's certainly increase in anxiety, depression symptoms, chronic stress. But what's encouraging is that 78% of employees reported this year that improving their mental health and well-being is very much a high priority for them. So recognizing that we all have bad days, speaking openly about mental health, it really does make a big difference. The more we can normalize this conversation by bringing up your own struggles, that really has a big impact on the workforce. And it could be something as simple as, I'm really struggling right now balancing remote school with my children constantly being at home and my husband working from home. It's a lot. And it's so different that this is something that everyone has had to deal with in many different ways. So by sharing your struggles, asking your colleagues to share theirs, inviting that open conversation, asking colleagues open-ended questions, whether it's, are you okay? Or how can I support you better? That really leads to an employee that is feeling supported and will open the door if more resources are needed. Now, there are many resources, especially right now. There are many virtual resources, but every organization really has benefits. What's important is that these benefits are accessible and that they are promoted, not just at open enrollment, but really throughout the year. So whether it's telemedicine, behavioral health services, an employee assistance program, EAPs, make sure that these services, these benefits are listed in multiple locations, whether it's virtually or if you're at the workplace physically, common areas, on department leaders' doorways, really going above and beyond to make sure that these resources are accessible. And not just posting it, but include the website, the phone number, and the company passcode, because some EAP providers need a passcode for employees or spouses or family members to utilize those services. And it's really it really makes a big difference when an individual is in a mental health crisis or needs additional help. The last thing you want to do is dig through a stack of paperwork from open enrollment to find the phone number and the passcode. Really, by having it accessible really makes a very big difference. You can also host virtual learning sessions on mental health topics, bring in mental health professionals, and this really gives employees strategies of different ways to cope. Touching on mental health is not a one and done conversation. It's not just at open enrollment or at an annual meeting. It really makes a difference if it's touched on touched on routinely throughout the year, whether that's hosting an annual a speaker or highlighting in a monthly newsletter. Again, those virtual opportunities, there are many out there right now. Utilize the resources that you have. There are many provided by insurance carriers, the CDC, the WHO right now, and look at what is available in your area. Mental Health America, MHA, is actually in the Wisconsin area. They have many different resources and trainings available for the workplace. So they are a good organization to check out. Your organization could also be trained in mental health first aid. And being trained as a mental health first aid provider doesn't mean that you're giving care for the individual needing assistance. It's really about recognizing those individuals that may need a little bit of assistance and guiding them or giving them the tools so that, again, it doesn't really snowball into a greater issue or to a greater crisis. So I'm going to turn conversation back over to Sarah to continue to talk about well-being and really the importance of physical activity at this time.
Yes, great. And so these all do work together so well, from mental to physical. But another thing that we are seeing is a stronger emphasis on physical activity going in 2021. And I think it's because the major impact that it has on whole health. This is like one of the biggest bangs for the buck that you will get from any well-being support or services you put out there. I mean, first off, it does have the positive impact on comorbidities that affect COVID, such as BMI and diabetes. And we know it works just as powerful as medicine for maintaining blood pressure and decreasing cholesterol. So we have that physical aspect from physical activity. But, if you don't want to be calling out mental health, but you want to be encouraging employees to do things that will make them feel better and sleep better, that's the power of physical activity without, saying it. We can just encourage a 20-minute walk in a day for anyone. That has the same increase on serotonin as Prozac or Zoloft do. To improve mood. It also stabilizes our stress hormones, so it has a good impact on stress, and we will sleep better that night. So all things, when you think about the different dimensions of well-being, that physical activity can have an impact on. And on top of that, in terms of what to offer and do in well-being programs, it's very easy to motivate and it's very easy to measure. But again, it really comes down to the evidence behind it. And in fact, a newer study just January this year shows that fit is in for COVID-19 and overall healthy living. So the power of physical activity has for employees to do better through the pandemic, the power to reduce stress, the fact that it plays a significant role in reducing fatigue, impacts overall quality of sleep, improves weight loss. And really, this is what you want from your well-being program. Physical activity improves overall quality of life. So lots of great evidence out there. And it just keeps continuing. I mean, if you think about the dimensions of health, you'd be like, well, physical activity doesn't do anything for financial health. But actually it does. In this study where they looked at people that were physically active for 2 months versus those that were not, they measured the impact on willpower at the end of that 2 months. And so they found that the active participants actually saved more money during that time, watched less TV, reduced their smoking. So again, all these really great things that you want from your employees to be able to take care of themselves. You don't necessarily have to teach them to procrastinate less or spend more, spend more time studying. If you can focus on this single thing of getting them more active, you get all these effects and positive impacts from that. And so how do you pull this all together? With the remote workforce in our new normal, what does it take? And Amanda's just going to talk a little bit about digital solutions, and they don't always have to be paid for digital solutions. A lot of great resources out there.
There there are many low-cost digital solutions that can impact overall being, and they also play a big role in engagement as well. Wellness programming leads to is an engagement strategy, and that's something else to consider. Utilizing social media groups, you can utilize those to create a group for employees to post content or to view content. You can also, I've mentioned surveys numerous times through this presentation. So using surveys is a really wonderful resource. I know we all have Zoom fatigue and have been sitting through virtual sessions for the past year, but there are really many different free options that are available right now, whether it's through your well-being carrier, your insurance carrier, or the CDC or the WHO. There you can find anything to really fit your population's needs. And again, when you're looking for a well-being program or a well-being platform, it's important to find one that has that whole health approach, whole person wellness, that has year-long engagement strategies, the ability to reach all employees. I think that's one of the most important tools right now, because we don't know if we're going to be in the office or all in the same place, or if it's at different project sites around the country. Also, being able to reach spouses, participating spouse partners is huge. So those communication tools, finding those in a digital solution or a well-being platform are extremely important.
So as we wrap up, I'll just show you that we definitely practice what we preach and what we hear from our clients, what we learn from what their needs have been over the last year and actually over the last decade of working with our clients. That is what we put into our program. We are being a privately owned company based here out of Wisconsin. It gives us the agility to be able to do that. But so some of the elements that we've embedded into successful well-being programs is the emphasis on physical activity. Again, because of all that evidence I shared with you of the positive impacts from a mental, physical, emotional, spiritual, there's really great positive effects from that. One of the things I've really learned through the years is that there has to be choice in a program. The programs I've seen do the worst, and it kind of was what Mascaro had and Amanda had prior, was I call them have to programs. Here is a biometric. You have to take it. You have to score well. You have to do one more activity through the year, and then you get this really huge premium incentive. And have to programs are not motivating for employees. They don't inspire them. It just feels like something they have to do. And I think with the future, and when that's a whole nother talk in of itself, but wherever the EEOC is going to land on their regulations the next year, have to programs could potentially be a thing of the past. And so I think it's important to offer choice in a program. The way we happen to do it is through points. Got to incorporate mental well-being education, activities, communicate what support employers offer for employees. So being able to communicate EAP and telemedicine programs. The other thing is just those have to programs are more like once a year. You have to do these few things. That does not change a person's health to do something once per year. And so programs really got to be pushed with year-round engagement. If you can attract a following through your well-being program and people are going there and they're checking things out, use it as one of those different communication options that, push out what all your company resources are, message out on safety initiatives, congratulate employees on their anniversaries. They're hanging out there anyway. You might as well use it as a communication platform. But at the end of the day, just keep things simple. When you try to overcomplicate and try to offer too much choice, again, when I've done those studies and data analytics on programs, the ones with too much choice are the ones that fail. I think they cause like a choice paralysis, and employees just don't understand, and then they don't engage. So things found within our program, or just probably in programs you're using, these would be the tips that I would leave you with. We are definitely open to answering any questions that you might have. It seems that you can use the question. We'll make sure, we'll work with Jennifer and Katie to make sure you get these slides and our contact information. There is nothing more that Amanda and I love to talk about than well-being and engagement. And it doesn't have to be anything to do with our program specifically. We love learning from other professionals out there in the market. So Jennifer, I'm not sure if you have any questions or any wrap up.
So thank you so much, Sarah and Amanda. That was fantastic. The question in the first question we had, of course, was, are you going to share your slide? Of course, you're going to do that. I would pose one question to you because I thought it was really great information in terms of mental well-being and mental health having a stigma. Mm-hmm. How do you suggest, or how do you go about approaching that conversation, whether you're in a small organization or even a large organization? You know, that seems to be a difficult conversation to have, or to provide resources, because everybody has their space or limitations or feeling comfortable health conversations. So how is that a conversation that you have, or provide resources and you know that they'll be used, or you have comfortability that they will be used? How do you go about doing that?
I have one example of something I've learned through the years, but then I would let Amanda, who's rolled up her sleeves and done it, straight on at organizations, answer too. But I would say it was at a WellCoa show maybe 4 or 5 years ago. I think it was Jason Morgan. He was with GE at the time, talk about his happiness index and all these great initiatives that they'd done globally across all these countries. But he talked about this story of where they had an on-site stress management course, and they had it in one room running at the same time, but they call it a stress management course. 2 doors down, he had a time management course. It was the same exact outline. It was the same curriculum, but not calling it stress management, by just renaming what the objective of the course was, and kind of putting it under there. They had 2 people sign up for the stress management course, and they had 56 for the time management strategy course. So renaming in a way has been something that I've implemented and worked with. But again, I think Amanda probably has some other examples on top of that of what she's done.
Well, and Sarah, that's really exactly it, is by offering activities or programs or resources that aid in mental health, that do it without doing it. So without sticking that label on it, that mental health label, having the resources accessible, even for blue collar industries. If you have a safety department, start talking about it in your safety meetings. Those happen daily at stand downs on project sites, and they happen routinely in the office. And I think really it's those baby steps, and they just start to build up over time. What I've done in the past is again, posting that information, making it accessible, putting it in many different locations where employees could reach it, and then developing programs that created awareness, whether it was boosting energy or eating nutritiously or connecting, that social connection, by having the basis of personal well-being, and having those 8 dimensions of point. Mental health is going to be in there. So it just takes one other thing that I've done that has been successful is to bring in those mental health resources to open enrollment. Open enrollment is always an excellent time. You have employees' attention, you have a captive audience, bring them in right away and showcase what is available, and make it not only accessible, but really putting a face behind the name, having people to relate to, and that employees can contact makes a big difference.
Thank you. That's very helpful. I don't have any other questions. So I really appreciate your time and your presentation. My takeaway was just really whether you're an employee or an employer, lead by example, be intentional, and set boundaries was just key to your presentation, and that really will help with this supportive environment. And that's foundational for our program at the Chamber of an employee-friendly workplace. And I can see that that's just key through your entire and critical for everything that you presented today. So thank you for sharing all of this information with us. Do you have
Thanks for
Thank
having us,
you.
Jennifer.
Sarah, someone did have a question about seeing one of your bar graphs from a survey. I'm not sure. I think it was right around the time you mentioned 94% of COVID mortality was due to lifestyle conditions.
We can expand on that. And then if it was the Artemis Health, the link to that will be on the slides as well.
Okay. Good. Well,
and your contact information is, I think it was at the beginning of the slide, correct?
Yeah.
Wonderful.
all right. I want to thank you again, Jennifer, for allowing us to share the expertise of Sarah and Amanda. It's something we're obviously really passionate about too. And I think the survey does a great job of starting the process with building awareness of where there might be gaps. We've obviously realized that mental health and well-being is important. But there are resources out there to allow you to take action. So that's the next step, and often the harder step. But hopefully everyone's gained something today to see where to start with the program. We know your time's valuable, so everybody in attendance, we really appreciate you taking the time. But yeah, I think it's inspiring to see companies realizing that if they start with their people, the rest will kind of take care of itself, and the stigma of mental health going away. But yeah, thanks again. We really appreciate it. And I'll leave you with a quote of one of my favorites. It's from the J.W. Marriott. He says, if you take care of your people will take care of your customers, and your business will take care of itself. I think the more companies focus on starting there, the rest kind of falls into place if you focus on your people first. And this is a way to do that. So thanks again, everybody. Stay warm, stay safe, stay healthy, and have a great rest of your day.
Yeah, thanks for spending time with us.
Thank you.
Bye.
Bye.